Good day. My name is George Perry. I'm the beef reproductive physiologist at South Dakota State University. And today I want to talk to you some about some research we've been involved with over the past several years, looking at the impacts of pre-breeding vaccinations on reproductive efficiency in cattle. And where this really started was several years ago, we kept getting asked the question, what happens when I buy replacement heifers and I know nothing about their vaccination history? What vaccines can I use and when can I give them? And so when we look in the literature, back in the 1970s, a lot of work was done on naive animals given modified lives. But what was always thought of is that when you give an animal a modified live, it gets into the dominant follicle, has an impact on the next luteal function, and impacts fertility that way. And after they clear out that next cycle, things should be fine. Well, with modern fixed-time AI protocols, what we do is we actually induce ovulation at the beginning of a protocol. And so in this study, what we actually did is we compared either 2 doses of an inactivated vaccine, 1 dose of an inactivated vaccine, a modified live vaccine, or a group just got saline. And we came into animals and we gave the vaccination at the start of the synchronization protocol. And so all of those animals, that dominant follicle would be induced to ovulate, where if the virus got into it, it should be cleaned out. Well, what we did was we tracked these animals after the time of fixed time AI. And what you can see here is that almost 40% of the animals that got a modified live still had an abnormal cycle, where those that got an inactivated vaccine were around 10 to 15%. And then, of course, our controls, we had no abnormal cycles. So you may ask, what is an abnormal cycle? Well, if we look at this, what we can do is see the green line here is actually a normal estrous cycle, what progesterone should look like. When we look at our other treatments, we see some of these that have a very short blip in progesterone, meaning they actually had a short estrous cycle, where the CL actually regressed prior to when it should. Or we see some of them that progesterone never really increased to the concentrations that it should be compared to our control. Now, what made this study interesting is, as I said, we came in and at time of GnRH, we vaccinated the animals. We induced ovulation of this large follicle, but we still had decreased fertility following the normal fixed time AI, and we had abnormal estrous cycles. The other thing is, in this study, we actually track these animals out throughout the next breeding, and we actually had decreased fertility. Only 30% of the animals even conceived on their second service. So what does this tell us? Is it tells us that in naive animals, these modified live vaccines can affect not only the large follicle that's there, but the next follicular wave, and even on out to the next estrous cycle. And there's actually some older literature that says in a naive animal, it can actually affect reproductive performance for up to 30 days after vaccination. And so if you have naive animals and you do not know their vaccination history, we need to be very careful on what we need to do, because not only is it affecting the estrous cycle, even with fixed time AI, but it can affect many stages of follicular development. So what is the best rule of thumb for naive animals? Basically, if an animal has never been vaccinated, we do not want to use a modified live at the start of the breeding season or start of a synchronization protocol. We will have detrimental effects. Well, then that brings us to the question, what happens when animals have been vaccinated? Because very frequently, replacement heifers are vaccinated around the time of weaning, the first time, and so they would no longer be naive animals. And there's a couple of studies that we've all referenced for several years. This first one, the one on the left, basically shows animals were vaccinated 3 times with their third dose either occurring 40 or 3 days prior to peak breeding, and we see there's no difference in either overall breeding success, first service, or second service. The other study that vaccinated animals either 30 or 9 days prior to the start of the AI breeding season showed no difference in estrus expression, AI pregnancy, or breeding season pregnancy success. Now, one of the interesting things is both of these studies, which we've all referenced for several years, all they did was compare the interval from the start of the breeding. There was actually no control to look at. Did it change compared to an inactivated or to a control group? More recently, there's been a couple of studies that have made us start to question some things. This is a study that actually looked at a modified live versus an inactivated vaccine. The bars on the left, animals were vaccinated either 40 and 10 days pre-breeding, or on the right at 61 and 31 days pre-breeding. And what we can see in both instances is somewhere between a 15 and 20% difference in conception rates, with the inactivated vaccine being higher. Now, in this study, there was only 10 to 20 animals per treatment, so there was no significant differences between the treatments. Another study actually compared a modified live to saline and showed a 20% difference. But again, there was 60 and 15 animals per treatment, and so there's not enough power to detect a difference. So a few years ago, we designed a study, and we wanted it with enough power to actually detect the differences, if they existed, down to about a 5% difference. So we actually vaccinated animals at 30 days pre-breeding. All of these animals had been on a modified live vaccine program for their entire lives, and the animals in this study ranged from replacement heifers up to 13-year-old cows. And what we did is the animals that in the dark green bar that got the modified live, they were vaccinated 30 days pre-breeding. The saline group was actually just given saline pre-breeding, and then the lighter green bar, they were given an inactivated vaccine, but since they were being switched over, they were vaccinated at 60 and 30 days pre-breeding. And what we can see here is there is at the 0.055 about a 5 to 8% difference in AI conception rates, comparing the inactivated vaccine to the modified live. When we look at our 56-day preg check, and why 56 days? That includes the AI conception and the first service to natural service. And we can see here that both the saline and the inactivated vaccine had higher conception rates in the first basically 30 days of the breeding season compared to the modified live. And that carried on when we go out to the end of the breeding season. The inactivated vaccine was still higher than the modified live. And so this first study, as I said, there was about 9 herds and just shy of 1,500 animals in it. We do see significant differences when given 30 days prior to the start of the breeding season. Now, a question that has come up frequently is what vaccine is better when we're talking about the viruses that we vaccinate for. And so modified lives or killed or inactivated vaccines. And there was a study that was recently been done out of Auburn that looked at that exact question. And what they did is they vaccinated heifers around weaning with either a modified live or saline. They bred them, and then prior to the next breeding season, they came in and a third of the animals were vaccinated with a modified live, a third were switched to an inactivated vaccine, or in this case, it's a chemically altered inactivated vaccine. So part of it is chemically altered so the virus can't replicate at body temperature, and the other part of it is inactivated, or with saline. And then after they were bred, they were actually exposed to PI animals to challenge them for both BVD and IBR, and they looked at abortion rates. What's interesting is in this study, of course, the control animals that just got saline, over 70% of the animals aborted. However, when we look at both the modified live and the inactivated vaccine, we can see about 10% or less of the animal, and there's no difference between these two treatments. So this tells us that this chemically altered inactivated vaccine does a very good job at fetal protection. And so what we wanted to do is build off of that information, and we went back and we took about 1,500 animals in 10 different herds. Again, these were everything from replacement heifers to 13-year-old cows. And they were either given a modified live in the dark green or that chemically altered inactivated vaccine in the light green. And we can see here our AI conception rates, again, were improved by about 5 to 8% in that inactivated vaccine. And so now we've got two different studies with over 3,000 animals that show the use of a modified live 30 days pre-breeding is resulting in decreased AI conception rates. Now, this second study, what was interesting is we actually vaccinated at different intervals. And the reason we did that was based on normal herd management. But we had animals that were vaccinated anywhere from 27 days pre-breeding all the way out to 89 days pre-breeding. And if we look within just the modified live group, so the 3 bars on the left, we can see when we got 37 days or shorter pre-breeding, conception rates were lower compared to when we were out greater than 45 days, so 46 to 89 days pre-breeding. Same thing in the chemically altered inactivated vaccine. As we got further out, we got better conception rates. So within either group, the longer pre-breeding interval, the better the conception rates were. There's one other study that has actually looked at this, comparing a modified live to an inactivated vaccine given 45 days pre-breeding in dairy heifers. And what they saw is when they were out 45 days prior to AI, they saw no statistical difference between the modified live or the inactivated vaccine. And so when we put that with our study, what can we conclude from things? Well, first off, modified live reproductive vaccines have the potential to adversely affect reproductive performance. As I've mentioned earlier, we've known since the 1970s in naive animals or in animals that have not been vaccinated previously, modified live can have detrimental effects. And from the study, our initial study, we showed that it's not only in the first cycle after vaccination, but even in the subsequent estrus cycle. So we can have negative effects up to a month or more. In well-vaccinated animal, what we're seeing is somewhere between a 5 and 8% decrease in conception rates when we're using a modified live at the recommended time of 30 days pre-breeding. And so as we've built these herds, as I said, we're at over 3,000 animals in 19 different herds. We know that something is going on. We don't know the mechanism right now, but we are confident that we are having an adverse effect. So how do we mitigate these effects? We know that proper preconditioning is important. It's important that animals get a modified live sometime after weaning to prime one side of the immune system. And what we're doing is actually a modified live gives us better cell-mediated immunity. And then as we get into breeding animals, it's important if we want to maximize our conception rates, we see that the killed vaccines give us better antibody-mediated immunity, which is allowing us also to get our better conception rates. Now, one important thing is before changing any of your program, you need to visit with your local veterinarian. And why is this so critical? Because your local veterinarian is going to know what disease challenges are going on in your specific area. And so when we think about everybody's area and what their animals are exposed to, sometimes it might be more critical to actually use a vaccine that's going to give you some better protection based on the disease load your animals are seeing compared to different parts. Here in South Dakota, a lot of times our breeding animals don't see other animals very much. And so we need to make sure and know what risk factors are involved with your herd. And so everything is different from herd to herd. And so with that, I hope I've kind of addressed some of the research we've been doing and explained how even when we talk about reproductive vaccines, we can have impacts on reproductive performance, and we need to be critical and evaluate our own management plans to get the best reproductive efficiency possible. Thank you very much.